Let's start. Welcome everybody. My name is Hendrik Dietrich. I'm the Science and Technology Managing Editor at getAbstract. In today's get-together session, we'll have the opportunity to talk to Dr. Martin Nufer, Director of the Hirslanden Clinic St. Anna in Lucerne, Switzerland. Welcome, Dr. Nufer.
Hi, everybody.
I prepared a few questions for the first part. And in the second part, we'd like to give our viewers the possibility to ask some questions. So dear viewers, please post your questions in the chat. The novel coronavirus disease outbreak has caused a pandemic. As of today, the World Health Organization has reported about 300,000 cases and about 13,000 deaths in 187 countries, areas and territories. Dr. Nufer, you are the director of a private clinic in Lucerne, Switzerland. Can you still cope with the demand? Do you really have 30 minutes to talk to us?
There are actually two questions. Demand is not really high at the moment in central Switzerland. Switzerland has of now roughly 8,000 cases in the whole Switzerland, but a large amount of these 8,000 are in the southern part of Switzerland, which is close to northern Italy. And this part of Switzerland is probably 14 or 21 days ahead of the rest of Switzerland in the wave. So the rest of Switzerland is just waiting for the wave to arrive. And that kind of is a strange atmosphere in Switzerland. Everybody is at home, the kids are at home, no school. Everybody is feverishly preparing for things to come, which we don't know exactly what it is. Mm-hmm. So it's a very parallel atmosphere to the reality. And actually, everything is pretty quiet in the hospital. Elective surgery, planned surgery has gone down a lot. So actually, we have a lot of excess capacity. Emergency rooms are really quiet, and everybody is waiting for the thing to come, and nobody knows exactly what's going to happen.
Yeah, and
what is really tough, of course, is preparing for what's coming, and that's where all the effort goes into.
Mm-hmm. I think in different parts of the world, different measures are being taken in the fight against the pandemic. A paper published by the Imperial College by Professor Neil Ferguson and co-workers has been essential for the US and UK to apply stricter measures than previously. I cite from the paper. Two fundamental strategies are possible. A, mitigation, which focuses on slowing but not necessarily stopping epidemic spread, reducing peak healthcare demand while protecting those most at risk of severe disease from infection, and B, suppression, which aims to reverse the epidemic growth, reducing case numbers to low levels and maintaining that situation indefinitely. The second option, suppression, obviously requires very strict measures such as social distancing of the entire population, home isolation of cases, and household quarantine of the family members for as long as 2 weeks. These measures would need to be maintained until a vaccine becomes available. But is the world prepared for this suppression strategy, and what would it mean, Dr. Nufer?
Well, I doubt it. Western society, at least, is probably not prepared to be contained, to be kept at home for a longer period. And I'm not talking about the economic results out of this. And the second thing you have to consider is that in order to make this suppression strategy work, you have to put it in place very early on. Otherwise, you're probably too late. So for us in Switzerland and even more in Italy, the mitigation is all that we can do. The rest is kind of the train is driving. Suppression is no longer an option for us. And of course, if you have the suppression strategy in place, then you have to fear the second waves, because we're probably going to talk about later the vaccine is probably not around the corner.
Mm. And if suppression doesn't work, or when it's too late for this, mitigation still has the potential to flatten the curve. This means that a considerable number of people would get infected and many would die, but keeping the number of cases below a certain critical number would prevent the collapse of the healthcare system. In Italy, the healthcare system is close to collapse, right?
Well, yes, the mitigation strategy is the only one probably we have, we can actually apply. And of course, we hope that we can flatten the curve. But if it is possible or not, we really just don't know. The preliminary data we have for our region actually shows that probably it's going to be tough, and probably the wave is going to be steeper and higher than what we hope for. But the jury is still out there. And for Italy and the southern part of Switzerland, where we have the larger numbers, reports we get are very different. You can talk to guys and they tell us that everything is under control. Of course, they're working like crazy, but it's controlled. And there are reports where you get the impression that actually this is no longer true and things are running out of hand. In the southern part of Switzerland, where we have very direct contacts, I think it's still under control, but you have to think that you have a certain capacity of ICU beds, say 20, and we're talking about tripling this number. And that's kind of what we say when we say it's controlled. You have 20 beds, now you're running 60. And you can improvise, you can plan for this. It's going to be a lot of planning and you need a lot of other resources, but probably it's doable. But once you go over a certain amount of beds and ventilators, probably you can't no longer say that's controlled. But
I was going
to
ask
a lot more than regular work.
I was going to ask about ventilators and supplies and protective gear such as face masks. So will there be a shortage? Do you have the required capacity? Are there enough healthcare professionals? Are they already overworked, or you say you're still in the preparation phase, at least here?
Well, of course, we do modeling as well as everybody, and we take into account that at the same time when we will get a large number of patients is probably the same time when we get a lot of sick leaves from our employees as well. So two things come together, which we don't like, actually. Material will be a problem because everybody, of course, is now going for the big number of supplies in the same area. So we're used for a certain number of ventilators to operate, and now we ask for the material for the threefold numbers of ventilators, or even the fourfold. And it's gonna be interesting to see if we can maintain this. For the start, it's no problem, but if it goes 2 or 3 months, we might get a problem. Of course, right now, nobody has the supply to do those ventilators, run those ventilators for 3 months. But we hope that the supply will increase over the time and we'll get more of these filters and whatever it takes to keep those things running. But of course, we get creative as well. We're trying to have textile face masks, things like these. We try to re-sterilize things we usually throw away. So we get really creative. I have some own experience from working in the jungle some earlier days, and I know that a lot of things are actually possible, but it's really a parallel, a new world we're going into, and I rather be kind of creative than running out of supply.
Yeah, so that's good to know. Yeah, and I think the progression of the coronavirus disease seems to take a similar pattern in different places. So in a week from now in the US, it could be the same situation that Italy sees now. On the other hand, South Korea has been very efficient in fighting the outbreak. They have taken very strict measures early on and tested large parts of the population for infection with the virus. They have used drive-through clinics. Basically, people arrive in their car and are tested without ever leaving it. Can we learn from this? And is there any advice that we can give to people in the US to prepare for what is to come?
Well, a lot of measures have been undertaken and we don't know really what works. I mean, you can use those drive-through testing sites. Korea has added to this a mobile tracking, and people have been contained in their apartments. So probably one measure is not enough. It's a combination of different measures which probably helps. And then there is probably also the culture, how people are living together. I have no idea whether this is important or not, but probably the way of living in Korea is completely different to Italy. I imagine Korea probably a lot of small apartments with 1 or 2 persons living in it. Whereas in Italy, we have a lot of apartments, especially in rural areas, where 3 generations are in the same apartment or in the same house. So transmission from kids, probably without any symptoms, to their grandparents, which are at risks, is much easily done compared to Korea. And these kind of factors, we have no idea how important these are. So if anybody would know exactly what to do, we all would do the same. And actually the information we got is really poor. And even the good medical journals, you know, they are all out running for information and publish them. And I'm sure the peer review process is not on a regular process. It's all speed up just to publish those things, those results, which we all waiting keenly, but not sure how good they really are. It's more stories told and a small number sample size of patients described, but nothing we usually can get from the medical literature.
Yeah, what we know is that this outbreak seems to be different from others. I think that's safe to say, right? Normally the disease transmission happens when people are showing symptoms, and you mentioned it just before. However, with a novel coronavirus, transmission can already happen when people are not sick at all or show only minor illness. So they can put others in danger. You mentioned those grandparents. Do you think everybody should be tested under these circumstances?
Well, it's not completely new. We know it from the flu as well. There are patients who have no symptoms. That's the reason we try to vaccinate all our nurses, because they can transmit without knowing they have the flu. So it's not completely new. The symptom pattern described in the literature so far is a little different from other viruses, but there is nothing really specific. No sign that we can say just clinically this must be corona, and that's what we actually experience also in the southern part of Switzerland. You have to test in order to know exactly what's going on. You need to prepare a large amount of tests if you can do that. If you have the facility, the chemics you need to actually run the tests, then that is really helpful. It's helpful for your employees to know who's really sick and who is not has another virus. And of course, you also need to have a clear diagnosis established if you want to go into treatment, probably off-label use of some medications which are around. So you need to have if you have a high lab capacity, that certainly helps.
Okay, yeah, and you mentioned drugs, off-label use, you mentioned vaccines, and I would like to go a little bit into this. So there are a number of drugs under development already. The development of a vaccine would normally take at least 8 months, or in some cases it can take years. But companies take novel approaches in the fight against the coronavirus disease. There is one company, Moderna Therapeutics, and it is testing a novel vaccine. It's actually in a messenger RNA identified 42 days after the novel coronavirus was sequenced. And they even started trials in humans without animal testing that is customary before entry into man. And another company, Gilead Sciences, is running phase 3 clinical trials with remdesivir, a broad-spectrum antiviral treatment that has been shown particularly effective against the MERS coronavirus. So what is the most likely outcome for the pandemic to end? Will there be some kind of herd immunity at one point? Will we succeed in suppressing it? I think you already answered that. No, probably not. Will a vaccine or just another drug be available fast enough? What would be your educated guess?
Developing a vaccine, as you mentioned, usually takes quite some time. So I'm curious about those novel approaches, and if they work, fine. I'm the first one to take it. Usually development is not the only thing. You have to go into large-scale production, and usually that's completely another problem. We're talking about, I don't know, billions of vaccine doses we need. And I doubt whether this will be available in the next 2 months, and that's the relevant phase for us. There might be areas in the world where you arrive in suppressing it, and that's where second waves, second outbreaks can occur. And there, obviously, a vaccine would be helpful. So probably it's not the either or which will happen actually in the world. There might be areas where we go through herd immunity, and others where a vaccine will still be helpful. So probably it's going to be a mixture if they come up with a vaccine pretty soon, meaning in the next couple of months. For us, I think it's going to be too late because I don't see it happen in 2 months.
Yeah, thank you, Dr. Nufer. And there are many more aspects that we could talk about, certainly, but I'd like to give our viewers the possibilities to ask some questions. And I just saw that one of the questions that came in was somebody asked whether a person can get reinfected, and if so, after how long? And you just mentioned this second wave and herd immunity, and I was just thinking about do we have any knowledge of somebody who already got infected can get infected again?
To my knowledge, we don't know that. The virologists, the specialists, they say that immunity is probably not going too long for the whole life, not lifelong immunity. So this is possible. We also need to consider that those viruses change in small parts, which leads to reinfection of not exactly the same coronavirus, but a variant of it. So it might be possible. It's, to my knowledge, not clear whether immunity lasts a year or 2 or 3, but usually the virologists say not a lifelong immunity.
And could it be that the coronavirus, or this novel coronavirus, will reappear seasonally? And that would be another challenge if the immunity doesn't last that long, right?
Well, the coronavirus is not really a completely new virus. As you are well aware, these kind of coronaviruses have been around in the couple of last 20 years twice. And the specialists always warn that this is gonna happen, and there is no reason why this shouldn't happen again in some couple of years. My take is that let's be prepared better than we are this time. I mean, I don't think we're really well prepared, and that has to change. Yeah. We have to go through this pandemic right now the best way we can, but afterwards we need to sit back, relax, and think hard. Yeah. How are we going to be prepared next time? That's the main focus for us.
And I think there have been critical voices before who mentioned that we may not be prepared, right? But let me pick up another question that came in. They want to know whether there are any children getting the virus in Switzerland, and why is it that kids seem to be getting that they don't get sick, or seldomly? Why is it different in kids?
The numbers I've seen so far from Switzerland are pretty similar to Italy, where the younger kids don't get sick at all, and very, very few below 20. And even the number between 20 and 50 are not very impressive. You get sick, but rarely critically sick. There are numbers, there are cases, of course, and those cases are usually one everybody tells to the other, but those numbers are really limited. The danger starts with 60 and comorbid patients, and that's where it really starts to hurt. Why children actually are not really affected, I don't know.
No, we don't know yet. Yeah, absolutely. And somebody is asking whether you have a more realistic outlook for the timeline for the development of a vaccine. Of course, I would like to know that too.
I mean, if we what we've seen so far, how long it took to come up with a vaccine, I would say months to years. Now, you mentioned the novel approaches, RNA and these things. I'm curious to see those things happen. I doubt it. I think we're going to wait a couple of months, maybe a year or two.
And do you think that our governments will take stricter measures in times where it's particularly where the situation is very dire, and then relax it for some time, and then go back and relax again, and go back and forth like that? Is that a possibility?
Well, these are politicians. They don't like to take responsibility if something goes wrong. So rather be strict, and if it works, you're the hero. But if it doesn't work, at least you have taken some measures. Yes, I think at least in Europe, it's gonna be a little tougher than right now. I think in Switzerland we have to face, the government probably is gonna forbid going out completely, except going to the doctors and shopping, food.
Like it already happened in other places, right?
Right. But that's basically, well, you can close down factories, which would be a huge economic impact, like in northern Italy. But then basically that's it.
Somebody is asking, and that's, you already mentioned or you talk about that. So, what is the medical community learning now that will help in combating future pandemics? So, is there something in particularly that we can learn now?
Interesting question. As I mentioned, everybody tells me that we need to prepare better next time. So those pandemic concept we had it somewhere stored away, far away. We need to take them out and renew it, and modernize it, bring them up to the date, and that's one thing. Obviously, it's very interesting to see how these coronavirus patients are clinically, how the ventilation goes, how treatments are. We try to do some drugs. We don't know whether they work or not. It's also interesting to see how an organization reacts to all the pressure. For me, a hospital, but also the individuals, who starts to panic, who is creative, how we deal with all those problems. And at the end, even as a society, how we deal with this kind of novel reality we're facing here, with all the measures we have to go through, how everybody reacts, and who is still compensated and who loses the nerve. We can learn a lot, and when it's through, I think probably in summer, hopefully, it's a good thing to reflect on what we've done and how we should do it next time.
Yeah, I think that is a perfect moment to end, although I guess we could continue our discussion for some more time easily. Thank you, Dr. Nufer, for the discussion and for sharing your expertise today. All the best for the clinic's work. And everybody, thank you for watching. Please follow the guidelines of your local government. Take care and be safe. Thank you, everybody.
Thank you.
Extraordinary challenges require extraordinary responses from thought leaders, company executives, and employees. As the coronavirus pandemic unfolds and businesses scramble to adapt to escalating containment efforts, getAbstract is here to help organizations navigate this crisis wisely and professionally. For over 20 years, we've been committed to providing relevant knowledge from reliable sources to help people make better decisions in their personal and professional lives. In line with our mission to empower decision makers with relevant knowledge from trusted sources, we are proud to offer businesses free access to our full library until May 18. Embark on a no-strings-attached knowledge journey with getAbstract. Sign up today.